Child CPR. Child CPR steps. Always observe universal precautions when rendering first aid care. Proper recommended protection for CPR consists of protective gloves and a breathing barrier. It is very important to protect yourself first. The 3 C's of CPR: check, call, care. Check the scene. Make sure the scene is safe before proceeding. You do not want to become the second victim. If the scene is unsafe or becomes unsafe at any time, do not proceed. Check for injuries. Is the body disfigured? Bleeding? Check for consciousness. Tap the victim on the shoulder and shout, "Are you okay? Are you okay? Are you okay?" Get help. Yell and shout for help. If someone is near, point to that person and have them immediately call 911. You call 911. If you are alone with a child, begin CPR immediately for 2 minutes before leaving the child to call 911. Begin CPR using the new CABD method. Compressions, airway, breathing, defibrillation. Compressions. Proper placement for chest compressions on a child is the center of the sternum. When giving chest compressions, you are pressing with the heel of your hand. You can do the chest compression on a child with 1 or 2 hands. You want to be directly over the victim with your arm or arms locked out. When you press down, you want to press hard enough to make the sternum fall at least 1/3 the depth of the child's chest. Once you press down on the sternum, let the chest recoil completely before the next compression. Deliver 30 chest compressions at a rate of at least 100 per minute. For one-handed CPR, place the heel of one hand in the center of the victim's chest. Place the other hand on the victim's forehead to help stabilize the head, neck, and spine. Begin 30 chest compressions at a rate of at least 100 per minute. The compression depth should at least be 1/3 the depth of the victim's chest. For two-handed CPR, place the heel of one hand in the center of the victim's chest. Your other hand can overlap your first hand or interlace with it. Do 30 chest compressions at a rate of at least 100 per minute, with a compression depth of at least 1/3 the depth of the victim's chest. Airway. Open victim's airway with the head tilt, chin lift method. Place one hand on the victim's forehead and the other hand under the victim's chin. While gently pressing down on the victim's forehead, lift up on the chin. Breathing. Pinch the victim's nose with the hand that's on the forehead. Deliver 2 rescue breaths to the victim. Once the chest rises, stop giving the rescue breath and let it fall. Once it falls, give another breath. Every individual will require a different amount of oxygen. Just make sure the chest rises and falls, rises and falls. Continue to give 30 chest compressions and 2 rescue breaths until help arrives, the victim shows signs of life, or an AED arrives on the scene. Defibrillation. Automated External Defibrillator, AED. Turn the AED on and follow the voice prompts. Make sure the AED has a child-specific system. Let's review child CPR. Check the scene. Make sure the scene is safe before proceeding. Check for consciousness. Tap the victim on the shoulder and shout, "Are you okay? Are you okay?" and make noise. No response? Immediately get a bystander to call 911. If you are by yourself, immediately begin CPR for 2 minutes before leaving to call 911. Begin CPR using the CABD method. Chest compressions can be done on a child with one or two hands. For two-handed CPR, place the heel of the hand in the center of the sternum. Place your other hand on top of your first hand. With your arms locked out and your body directly over the victim, begin 30 chest compressions. Compressions are done at a rate of at least 100 per minute and at a depth of at least 1/3 the depth of the child's chest. After 30 chest compressions, you want to open the child's airway with the head tilt chin lift method. Place one hand on the child's forehead and the other hand under the child's chin. While gently pushing down on the forehead, lift up on the chin. Pinch the victim's nose with the hand on the forehead. Deliver 2 rescue breaths to the victim. Continue 30 chest compressions, 2 breaths until paramedics arrive, the victim shows signs of life, or a defibrillator comes onto the scene. For one-handed CPR, place the heel of one hand in the center of the victim's chest. Place the other hand on the victim's forehead to help stabilize the head, neck, and spine. Begin 30 chest compressions at a rate of at least 100 per minute. The compression depth should at least be 1/3 the depth of the victim's chest.